It's pretty frequent for kids to have a flatness on the back of their head or on their skull. Sometime, the majority of that time, that's skull deformity is related how the child lays on their back, but sometimes that skull deformity can be something called craniosynostosis. And what that is the skull is made up of several different bones, and the junctions between bones we call sutures. And sometimes those sutures fuse early, and it gives the head a very characteristic shape. The big concern for that is the skull is not growing correctly, but it's brain growth that drives skull growth. So the brain exponentially grows during the first 2 years of life, but skull growth or bone growth is typically a slower process. So typically what happens is the sutures will sense some stretch and say, hey, the brain is trying to grow, we got to make a lot of bone, so it'll rapidly grow out. If those sutures are fused and locked, they're not getting that rapid growth from there. And the concern can be that the brain is growing faster than the skull. And the concern for that is it could be putting pressure inside the head called intracranial hypertension. So that is something that we typically would recommend a surgical correction for. To correct a craniosynostosis, it's a procedure we call a cranial vault remodeling. Essentially, we take off the skull. We don't actually see the brain. We don't do anything with the brain because the brain, it actually lives in essentially a leather sac called the dura. And above that dura is the bone. So we take the bone off and then we can reshape that bone. We'll oftentimes make the skull bigger to increase the size of it to allow that room for the brain to grow. So the skull has an inner table and an outer table, and we can actually split it like an Oreo cookie or an ice cream sandwich and use that to fill in any gaps after making it bigger and changing the shape. Craniosynostosis is not a very common thing. It can be in one in every couple 100,000 births. As I said, typically a skull deformity is related to position and how the infant's been laying on their back. Since the 1990s, when the American Academy of Pediatrics instituted the Back to Sleep campaign, it's become very common to get some flatness on the back of the head because all kids go to sleep on the back of their head. So hopefully this should be something that's getting picked up by the pediatrician, or oftentimes the parents will say, hey, look, this just looks off to me. Is there something going on there? Some parents can be concerned about the scar from a craniosynostosis correction. If the scar is done in a straight line across the head, sometimes the hair can part along that, especially when a child gets out of a swimming pool. So what we do is we make a wavy incision across so that that hair can fall over the scar. So hopefully it keeps it much more camouflaged. There is not any hair loss associated with this procedure. Scars will not have hair grow through them, but it should be a nice thin line coming across there where the hair follicles are able to fall over top of the scar to keep it hidden. Typically, if a craniosynostosis is corrected, it only has to be corrected once in life. The kid's skull will eventually continue to grow normally and should hopefully not have any long-lasting issues. Once that brain stops exponentially growing, then normal bone growth can take effect. So typically bone grows by deposition and resorption, like bark on a tree. It puts a layer down, takes a layer away, puts a layer down, takes a layer away. That's a fine growth after that exponential growth is done during the initial childhood. While treatment of a craniosynostosis sounds pretty frightening, I have the luxury of saying it sounds worse than it is. I've been involved in hundreds of these procedures. There's a relatively low complication rate. It's basically just some carpentry skills to make the box a little bit bigger.